Asthma webinar 2.
Yay!
So welcome back everyone to our second webinar of asthma. In the first one, we discussed the basics of asthma. Let's go to a recap. It's a long-term condition that can affect your breathing. We talked about the symptoms.
Yep, so tightness of the chest, wheezing or coughing.
We discussed that the asthma diagnosis is not always easy. Sometimes we can tell by the history, but other times we need investigations. The management might include
inhalers, you've got tablets
or some other kinds of
injections
medications
even.
sometimes. Yeah. And then the inhalers we discussed the preventer, reliever and the MART therapy as well. We discussed the top tips for asthma for you or someone you might know. So yeah, thank you very much for tuning in again. Okay, and on our second webinar, we're going to be discussing asthma attacks and what exactly they are and what you might do if you're experiencing one. So I'm going to hand you over to Saira.
Maybe we could start off by talking about how it feels, like what kind of symptoms you experience when you're having an asthma attack.
So when you're experiencing an asthma attack, some of the first symptoms you'll be experiencing are worsening of your coughing, breathing in difficulty and chest tightness as well. You might notice that your inhalers aren't working as well as they were previously. And that's the time really you need to start thinking about getting some help or trying something different.
On that point, remember your inhalers, guys, because there's been so many times that I'm out and you just think, oh, I don't really need it. But remember to pack your inhalers wherever you go, wherever you are, like just keep it in your bag, or like if you're at work or school, try and just, keep it with you.
Yeah.
Because you never know when you might need it.
That's right. And remember your peak flows as well, because that's often a good indicator if your asthma is not very well controlled. That's okay.
Okay, I mean, I'm going to be practicing. Next week, guys, next week I'm going to do this again. Yes. Do you remember last time we did this and it didn't work? Oh, there we go.
It worked fine. You said you were going to practice your technique and come back and,
we'll talk about that later.
So peak flows are important and they can give you an idea if your asthma is not very well controlled, and often they can hint at an asthma attack which might happen in the future. So do keep an eye on your peak flows. Keep a diary if you can as well for your readings. That would be helpful. So,
okay. So it goes up to 800, well 900. We'll test if it gets to 900 later on.
I don't think that's going to happen. Okay. So children might actually experience an asthma attack in a different way. They might even experience chest pains or tummy pains as well. So keep an eye out for that. There are asthma attack risk calculators available online as well, and we can post a link to that if anyone's interested in visiting that website. So next we'll be moving on to asthma attacks and what to do if you experience an asthma attack. Last time we covered it briefly. So Saira, do you remember what we would do if somebody's experiencing an asthma attack? The first thing?
Don't panic.
Yeah, don't panic. Yeah,
don't
so
panic.
Try and stay calm.
Yeah.
Sit up straight as well.
Mm-hmm.
Because if you're panicking, it might actually make it worse than the asthma symptoms. Yeah. So the next thing is we're going to use the reliever inhaler. For most people, that's the blue one, which we call salbutamol. And you can use a puff every 30 to 60 seconds. Usually you want to shake the inhaler, use a spacer device to connect to it if you have one available, and then that's the best way to use an inhaler. And then you can repeat that puff every 30 to 60 seconds, and if you can do that up to 10 times. Mm-hmm. And what happens if you're still not recovering?
Call an ambulance.
Yeah.
Let's get the phone out.
What's the number? 999. Yeah, and you ask
for
an ambulance.
Help me.
If you're in the UK, it's 999. And then if after 10 minutes an ambulance has not arrived, then you can repeat step 2 again, which is using your reliever inhaler again every 30 to 60 seconds. So that's the steps summarized for what to do in an asthma attack. So Saira, you had experiences as a child of experiencing asthma attacks, but what actually happened as a result of those? What were the next steps when the ambulance arrived to see you? Do you remember?
Yeah, so I think it was interesting you mentioned actually, because it's different with children and adults, and I see that now. So when I was a child, it was a lot different to how it is when you're an adult. When I was a child, the big trigger for me was like pets, so animals, especially cats. So I remember I used to go to my auntie's house, she used to have a cat, and I used to love cats, like I love cats. So 10, 15 minutes after that, I'll notice like my breathing, kind of chest tightness, feeling a bit like, coughing. So yeah, again, following the steps that you mentioned, making sure that you're kind of sitting up, taking the inhaler. I used to have a spacer as well. We did have a hospital close by, so we would kind of drive there, or if it was an emergency, call the ambulance. I remember going in. I remember it was cute because they had like very colourful wards, so it doesn't feel like you're in a hospital. So you'd get taken into that children's ward, and then you would have this huge nebulizer. Should we cut to nebulizer?
Yes.
Which would look something like this.
Okay, well.
But we're going to open it and show you guys in a minute.
So usually when an ambulance and paramedics are called, they will assess you and they'll see if they can provide any immediate management for you. Oh yeah, there's the oxygen cylinder as well. So
very important to save your life.
it probably looked a bit scary for you as a kid. So if they feel it's necessary, they can refer you on to other services, whether it's taking you to the hospital or onto the GP as well for a review, or your asthma nurse.
This would make a massive difference. So I'd feel it just by having that on my face for like about, 10 minutes or so. I'll just feel like I could just breathe again.
I see, yeah. And that's why it's really important to have good asthma control. So after an asthma attack, it's highly recommended that you book an urgent review with your GP for that reason, so they can come up with a plan for you. Let me show everyone.
Something like this.
It might look
asthma action plan. So you've got all the information about what to do. It's really important to go for your asthma reviews. So you just, like Vin said, you're taking the right inhalers. It's good to keep that on your fridge or somewhere as well, just so you're always reminded.
Yeah, and they're likely to go through your asthma medications and do a review of that and change them if it's necessary. Now, do you remember receiving any other medications as well once you'd had your asthma attack?
Yeah, so when I used to go to hospital once I was on the nebulizer, and sometimes I would get these like pink tablets.
Yeah.
They would give me. They tasted disgusting. But
yeah, those are the steroid tablets. Usually it's the prednisolone ones that they give out. In severe asthma, they might even need to give an injection of, like, for example, adrenaline. And that's a kind of a one-off usually. But yeah, that's all the important things we wanted to discuss about asthma attacks today, and important points for you, or if there's someone you know who has asthma, to really think about, and good takeaway points.
Next episode, we are talking about mold.
Okay.
So we're going to be talking about certain triggers. So interesting one next week. So make sure you're here.
Yeah, stay tuned, everyone.
Is there anything else we need to cover? I can't remember.